What surgery do I need to correct my eyes? My eyes are not even, they are completely different. My right eyebrow is much lower than my left. The right eyelid comes over the top of the crease. When I pull my right eyebrow up to match the left, the eyes seem normal again. So, is it my eyebrows that are the problem? Which surgical procedure would you recommend to correct this so that my right eye looks like my left? Just want to add, this unevenness has gotten worse in the past year and a half. 3 to 4 years ago, my eyes were perfectly even.
Thank you for your question. You are describing a very common problem or situation that we see in our practice, which is the asymmetry of the face resulting in an asymmetry in the shape of the eyes. So your right eyebrow being much lower than your left, if this is something that has always been the case, well, then most likely this has to do with the natural bone structure and then the soft tissue overlying the bone structure being something that's constant. We refer to a term called hemifacial microsomia, which means one side of the face is smaller than the other side. So although you didn't send a full face picture, you can take a look at yourself and notice that maybe one side of the face, the cheek, is less projected. So when you have this type of asymmetry, it is natural that soft tissue tends to descend, relatively speaking. Sometimes the amount of volume in the upper eyelid is such that it obliterates the definition of the eyelid crease. So what I would do in my practice for someone like you, now this is based on the photos, not based on a physical exam, but routinely in my practice, what I tell my patients is I can make you or I can help you look more symmetric, but I can't help you look 100% symmetric. I can essentially, it's all about creating the balance so that when we look at people, most people are actually asymmetric. And so typically in a situation like yours, I would do an upper eyelid blepharoplasty. Basically a conservative removal of some extra skin over the eye to compensate for the relative difference between the two eyebrow heights and subsequently or consequently the relative amount of skin over the eyes. Now, some colleagues of mine, and this is sometimes in older people where there's a lot more elasticity of the skin, sometimes they will actually Botox or relax the brow that's higher to bring it down, again, depending on the patient's aesthetic concern. Since you've expressed a concern about your eyes, I think that an upper eyelid blepharoplasty done conservatively, done to try to match the crease of the other side, will probably be the most practical solution for you. If there is any issues with the dynamic activity of the muscles in the forehead, then some Botox or other things can be implemented as part of your strategy. But understand that we are beautifully imperfect and that asymmetry is normal. This being a particular area of concern for you, I would say that the right upper lid blepharoplasty is probably the practical approach without being too aggressive to give you a little bit more of a match between the two eyes. So I hope that was helpful and thank you for your question.